Welcome to Learning Plan 10. We're going to be talking about analgesics and musculoskeletal pain, but mostly analgesics. Before we get into the actual medications, let's talk about pain itself. There's two types of pain, acute and chronic. Acute is that pain that comes on quickly, sudden, and usually once the underlying cause of the pain is treated, it goes away. Chronic pain, persistent or recurring. It can be very difficult to treat. Chronic pain lasts more than 6 months. This kind of pain commonly doesn't just go away. It can be minimized, but unless the absolute underlying cause and source of the pain can be found and resolved, the pain will never really fully go away. Tissue injury causes the release of several substances like histamines and prostaglandins, potassium and serotonin. The release of these pain chemicals initiates action potentials at the distal end of the sensory nerve fibers through pain receptors. Now, those impulses are conducted along the nerve fibers, and they activate pain receptors in the dorsal horn of the spinal cord. Now, this is where the gate is found, in that dorsal horn. These gates regulate the flow of sensory nerve impulses. If impulses are stopped by a gate, just like anything else, if the gate closes, nothing goes past. Several current pain medications work by altering the action and levels of these substances. NSAIDs are the primary ones. They decrease prostaglandins, and antidepressants decrease serotonin. Now, the gate theory, this is common and fairly well described. It uses the analogy of a gate that blocks a pathway. Okay, these nerve fibers these small diameter nerve fibers carry pain stimulant through the gate mechanism, but these larger diameter nerve fibers that go through the same gate can inhibit the transmission of the smaller nerves carrying the pain. They kind of override and overrule those smaller fibers. The pain gate can be shut by stimulating nerves responsible for carrying the touch signal, the mechanoreceptors, which enable the relief of pain through massage techniques, rubbing, and the application of heat bags and ice packs. Pain gate can also be shut by stimulating the release of endogenous opioids. Those are opioids, pain-relieving chemicals released by the body in response to pain. Acupuncture and TENS units, those electrical analgesia units, are thought to stimulate the release of those chemicals, those endogenous opioids, as a response to stimulation. And that will override the pain coming in from the nerve fibers. Another way of generating endogenous opioids, have you heard the phrase runner's high? The running can actually stimulate such a chemical to help block the pain and discomfort associated with that. But not any one treatment will work for everybody. Just like we talked about with depression and blood pressure and cholesterol and most recently diabetes, we are all unique, and we all need different methods of dealing with pain. What works for you may not work for me. We look at what's the source of the pain, how bad is the pain, where is it located, and we can find ways, pharmacological and non-pharmacological, to help reduce that pain, maybe make it go away. So, like non-pharmacological, as nurses, we can do a lot of those. We can teach relaxation techniques, distraction. TV, it can be a distraction. Massage, guided imagery, hot and cold packs, music, meditation, and therapeutic touch. These are all methods of reducing pain without adding chemicals. Of course, they won't work for everybody, and they may not work completely. They can be used as an adjuvant, as a second approach to the pharmacological. something as simple as Tylenol, acetaminophen, NSAIDs, opioids. And then we have other medications, the true adjuvant medications, such as tricyclic antidepressants and SSRIs and NSRIs and anti-epileptics and even local anesthetics. We have many ways to control pain. The key is we have to try. We have to try as many methods as possible to get relief to our patients. Now, there's two main types of pain. There's nociceptive and neuropathic. Let's talk neuropathic first. Neuropathic is pain that occurs due to injury or malfunction of a neuronal transmission or poor regulation. Diabetic neuropathy, phantom pain from an amputation, shingles, multiple sclerosis, or spinal cord injury pain. Those are all pain that comes from malfunctioning or damaged nerves. Commonly, this type of pain is characterized as burning or shooting pain, or electrical sensations. Nociceptive pain is when the pain impulse is actually operating normally. And pain is a good thing. Pain helps us find where the problem is. If you can't sense pain, you have greater problems, which is why people with neuropathic pain from diabetes, when they injure their feet, develop sores that they don't know are there. They can't feel that pain. So nociceptive pain is good. There's somatic and visceral. Somatic pain, I've been having somatic pain in my knees. Somatic pain comes from bones and joints and muscles, skin and connective tissue. When you're working on building a project and you whack your thumb with a hammer, man, that is somatic pain, right? Visceral pain, that comes from organs or the GI tract. When we're talking about anti-ulcer medications, ulcers cause visceral pain. Heart attack, it's visceral pain. Kidney stones, visceral pain. So pain covers many different things. We have to be as specific as possible if we want to describe it accurately so we can treat it. Somatic pain is usually very well localized. When you whack your thumb with a hammer, you know you hit your thumb. Visceral pain sometimes can be very poorly localized, and it kind of sometimes feels crampy or achy or just those kind of descriptors. And visceral pain sometimes will refer to other parts of the body. Heart attack can refer to the back. Gallbladder can refer to the right shoulder. So visceral pain can be kind of problematic. But once you realize what's causing the pain, then you know how to treat it, or at least you have a better idea how to treat it. So what kind of drugs are good for each kind of pain? Well, the neuropathic pain, we're not going to generally use the traditional painkillers. We're going to use anticonvulsants, benzodiazepines again, tricyclics, the SSRIs and NSRIs, but they're not as effective as tricyclics. We might try opioids, but they are much less effective for neuropathic pain as they are for nociceptive pain. Nociceptive pain, Tylenol works. NSAIDs like aspirin and ibuprofen work. Opioids and local anesthetics, those work to take care of the nociceptive pain. Now, how do we know what to choose when we're looking at nociceptive pain? Well, we have to look at, first off, what's causing it and how bad is it. You whack your thumb. We're going to go back to that because I've done that many times in my life. You whack your thumb, it hurts, but at most, I might take an ibuprofen, probably just ignore it. It'll go away unless I broke my thumb. So mild pain, on a pain scale from 0 to 10, with 0 being no pain, 10 being the worst possible pain. If you have a pain score of 1 to 3, you're looking at probably acetaminophen or an NSAID. Acetaminophen, of course, Tylenol. NSAIDs would be ibuprofen, naproxen, ketorolac. Those are NSAIDs. They work very well for mild pain. Suppose you had moderate pain. Suppose instead of just bruising my thumb, I crushed the bone. Okay, now I've got at least moderate pain. Pain's going to be like 4, 5, or 6. Now we're looking at stronger medication. We might go to ketorolac, but we might do it IV. We might give oral medication like a acetaminophen opioid combination like a Vicodin or Tylenol 3. That's Tylenol with codeine. We might do Percocet, which is oxycodone with acetaminophen. But we're going to be giving usually oral pain for moderate pain. If you have severe pain, you had a crushing injury, a major surgery, your pain level is 7 to 10, you're going to have to go with opioid, and more than likely it'll be IV. Oral medications takes a long time to work. And most oral pain medicine take 30 to 60 minutes to start to having effect. If you have severe surgical pain, you can't wait 30 to 60 minutes. You need IV medication. So you're looking at morphine, which is kind of like the gold standard of pain medicine. Then there's hydromorphone, and there's fentanyl, which is a synthetic. These work very well for severe pain. Come back in the next section, we're going to start talking more about opioid analgesics.